When we think about health, we often think about hospitals, doctors, or medicines. But what if health were less about what happens when we don't have it and more about what you and I can build together? What is Movements for Health and why is it relevant today?
Singapore boasts one of the highest life expectancies globally. But we are not necessarily living healthier. On average, Singaporeans spend about 10 years in poorer health, often dealing with illness or disability. And that's the gap between lifespan and health span. In other words, how long we live versus how long we live in good health. Ideally, we would want health span to be as close as possible to lifespan. And as our population rapidly ages, with 1 in 4 Singaporeans aged 65 or older by 2030, our challenge is clear. How do we help people not just live longer, but live well, staying healthy, active, and independent? In fact, studies show that up to 60% of a person's health is influenced by social and behavioral factors. This is compared to 10% influenced by healthcare. This highlights the need for a whole-of-community approach to integrating healthcare with community support for better outcomes.
Movement for Health is a ground-up approach where we leverage on the community, social movement, as well as the collective action coming together. We believe that by empowering the communities, letting them take charge of their own health and have a sense of ownership and agency will help them to enjoy and how they could then improve their health. We do that through our passionate organizations, Community Movement Champion or CMC in short. We believe that our CMC understands their members and the public better in terms of what resonates with them, how they can then embed the health into their daily activities. And we support our CMC through our sectorial as well as community coach, where they share with them about health literacy, social, behavioral, as well as social innovation. And we validate our work through research as well as partnership.
The guidebook, Design the Good Life, Health as a Social Movement, outlines 3 stages in building health movements: awareness, adoption, and advocacy. Over the next 3 episodes, we'll dive deep into each of these stages, bringing you real-world examples from community movement champions on the ground. First, awareness. This is where individuals or communities are activated as they become aware of an issue, moving beyond just mind to heart to motivate action. We'll find out more about Better It Better, a participatory project conducted by 3 Pumpkins, where they support children to turn insight into action. Next, adoption. Here, people are motivated to take action on behalf of the issue, generating community ownership and leadership, moving beyond consumption to co-creation. We'll explore this through how Beyond Social Services and the LACE team from NHCS support their residents and patients to become community leaders. We will hear about how they built a participatory approach, fostering community ownership by framing health issues in the residents' and patients' own voices. Finally, advocacy. This is where we multiply impact and take the movement beyond self to us through establishing networks and partnerships. Living Well at School by NHG Health provides great insights on how deep collaboration can embed health literacy in school life, creating long-term impact and sustainability. The journey to design the good life is about recognizing people's power to shape their own health and communities. It's about building a healthier society, one community, one movement at a time. Get ready to see the full spectrum of community-led health transformation as we begin our deep dive into the awareness stage in our next episode.